The chest wall deformity that I have is known as Pectus Excavatum. I knew that I had a chest wall deformity when I went to see a pediatrician at UCSF when I was 11 years old. The deformity caused me to be very self-conscious about my appearance and also made me susceptible to others' perceptions of how I was and kind of undermines my own natural self-confidence. The condition preoccupied my thoughts, and I would say maybe half of all my thoughts were related to the deformity. Majority of it, I'd say, was caused by myself just thinking about it and guessing as to what others would think about it. I did have conversations with friends and peers, but I would say the majority of it was curiosity on their behalf. I did experience physical effects from the Pectus Excavatum. A lot of loss of stamina, shortness of breath, and pain after intense exercise were some of the symptoms I noticed and worried me. I discovered on my own. I went online and found many resources I could use to figure out more about my condition. And through the help of UCSF, I was able to figure out the right treatment for me and eventually receive that treatment. I had the NUS procedure operation to correct my Pectus Excavatum, which involved the inserting of a bar in my chest to push out the sternum that was caved in from the deformity. Covered pretty quickly. I was in the hospital for 5 days. 4 months later, after the surgery, I feel great. Not only physically am I able to take deep breaths, but also psychologically and mentally I feel very clear, and I'm no longer worried about other people's perception of my deformity. For anybody else with a chestal deformity, I would, one, relax, because this isn't something that you want, but it's something that you have, and I think that you can take steps to find out more about it and how it happened and why it's here, and then also steps to figure out how to get rid of it and how to live with it. And I think that, you know, as long as you're informed about the surgeries that you can take, and also to be confident in yourself that others are more curious, I would just be open to acknowledging that you have this deformity, but it doesn't set you apart from anybody else.
I would say it was difficult. However, really what happened was I was introduced to it when he was 11 years old. We went and had an original discussion with the doctor. And the first time I heard about it, I thought, wow, that is a huge procedure. But as time went on and my son grew up and became an adolescent and pointed out to me how it was progressing, I began to really listen to him more carefully and realized how much it meant to him. And that gave me a lot of strength. I think after that, I did a lot of research. I talked to people who'd had the procedure done, and in fact, one family had looked all over the United States, and they said the best place to have it done was UCSF. Well, the hospital experience was great. I'd never really been in UCSF before. I have some hospital background. I was so impressed by the staff. I found that not only did they give the patient a lot of attention, but they also gave the family attention, and that's very, very rare. I am so pleased that we went ahead together with this procedure at the right time, and it's life-changing, and we couldn't be more happy with that decision.